the opportunity to represent as an alumni and talk to you about the experience uh, with Amity so far. So I am Jocelyn Johnson. I joined Amity in the year 2016. Back 7 years before, I was a fresher in Amity. I joined to pursue a bachelor's of pharmacy. I completed it in the year 2020, and amidst the chaos of the COVID-19, without any second thought, I decided to pursue a master's also from Amity. So I was there with Amity for continuous 6 years, and the 6 years I would like to divide it into three phases, which I would like to tell you about the journey. So the first phase, in the initial couple of years, I would like to tell it as dare to dream phase. So that was the years where the dream which came true for me. I got admission in Amity. I was admitted to Amity for the program, and I actually moved from South India to North India just to be with Amity. And also it was daring too, because it was all a new crowd for me. So it was essential for me to break the comfort zone and come out of it. So, and thereafter, during the third and fourth year, I would like to say it as the designing phase, wherein I researched about the career prospects of pharma field. So that's how I got interested in the clinical research and the regulatory affairs uh, area. And I actually, in the third and fourth year itself of the bachelor's program, I decided that I'll be, pursuing masters from Amity only, that too in drug regulatory affairs, because I have that area of interest. So soon after the graduation, I, uh, got admission for M-Pharm program in Amity itself, and that phase, I would like to call it as the third phase, as a do phase, wherein I could actually, challenge myself and do things. And in the fourth semester of the M-Pharm program, I got placed in WNS Global Services, and there was a time wherein I could, I was able to manage both work and to do the thesis of the final year project. And later, soon after that, after completion of masters, I realized that the role which I'm doing with WNS was actually not the area of my interest. So the role which I was doing with WNS was regarding the market research, and always my area of interest was regulatory affairs. And that's how I decided, without any offer in or having any offer in hand, I decided to resigned from WNS, and I decided to search for jobs which is only related to regulatory affairs. And that's how I got an offer in Freya Solutions. Currently, I'm working with Freya Solutions Hyderabad. It is a global regulatory consulting firm, and I work as an associate in medicinal product publishing and submission team. And here, what I actually do is I help my client to submit various clinical trial submissions in the regulatory portal of EMA, that we call it as a clinical trial information system. So same as we have SUGAM for India CDSCO, we for EMA we have a clinical trial information system. So I work with the client to submit clinical trial applications. So that is pretty much about my professional journey. And I would like to conclude my words by saying a big thanks to Vikesh sir and Sandeep sir for giving me this opportunity to speak to you all people and express and share my journey so far. Thank you so much.
This Jaslin, we will just like to request you if you can share your present responsibilities.
Could you please be more louder?
We just request
Yeah.
If you can share your present responsibilities.
So my current responsibilities include to submit various, clinical trial submission. We get a lot of document from clinical trial organization. Sorry, contract research organization, CROs. For example, IQVIA, Sinos. We get various documents, and we QC those documents, which is necessary for the submission of the clinical trial. For example, we need documents which is the essential, such as informed consent form, uh, cover letter of sponsor, cover letter for investigator. So we actually conduct a quality check on these documents. After, if the the documents is good, then we upload these documents to the clinical trial information system, which is the regulatory portal. Uh, and after successful upload, we actually submit the application, and after that we get the response from the EMA regarding the authorization of the clinical trials. So that is pretty much about the role here.
Uh,
Definitely a very good morning.
Good morning, sir.
Good to have you in this early morning.
Thank you, sir. Thank you so much for having me here. It's my
Uh,
absolute pleasure to be with you all again,
Definitely
once
pleasure is
again.
mine. I would like to ask you your message for your juniors, for inform juniors, what they should do, how they should prepare.
Yeah. So message for my juniors. Actually, there were time in my life too, wherein I was, in the verge of giving up, or I also had a self-doubt kind of things, whether I am going in a right career path or not. So later I decided, even if we are having the self-doubt or confusions, it's just because we are thinking outside the box, or we are coming out of the comfort zone we are having. So never think of giving up. So far you have come, so you will definitely go to the right place. So I wish you all a very success for your future. Thank you. Mute, sir. Amity is mute. Yeah.
Thank you, Justine, for your talk. You very much, Justine.
Thank you so much for having me.
Yeah, thank you.
Thank you.
You're most welcome.
Hey everyone, good morning. I am Anaza. I have done my master's from Amity University, Noida in the year 2021 to 2023. Before that, I did my bachelor's from the year 2017 to 2021 from the Integral University, Lucknow. And in the year 2021, as of we already know, the COVID happened. So after that, I was make sure that I have to take admission in Amity University, Noida only. So I got admitted in the branch pharmacology in the year 2021, and I did my master's from 21 to 23 from there. In my whole master's journey, I have learned a lot under the guardianship of Dr. Bhupesh Sharma. He is a great mentor, and he taught me. He has shaped my personality in many other ways. I have written the reviews as well as the research papers also, and I think writing reviews and research papers shapes your career, your skills in very various other ways. So I would suggest, and I will tell every master aspirant who are joining the Amity University Noida, to focus apart from your normal subject that you have to go through in your semesters and all. Do focus on research and reviews, and they will shape your professional career, no matter if you want to go to the industries or if you want to be in the academics field. These research and as well as the review paper will give you a brief, or you send they will give you a kind of skill set. Right now I am working, I got placed on the third semester, the pharma ace company visited, and there were the 3 or 4 rounds that I have cleared, and I got selected in the third semester itself. And right now, I am working as a data analyst in this firm in the forecasting department. Here I have to basically forecast like this is a consulting firm, so various company consult here and ask them, okay, what will be if I'm launching this particular drug, what the drug will be doing in the next 5 years. Like this right now it's 2023, and I have to predict what will happen to this drug when it launches the market, what will the market share, what will it the market size, what will the patient size. So I have to do this kind of thing. I have to predict basically. So I have to research the same thing what we do in the research and the review part, that what will be your size, what will be your target population, and then there will be the prediction happen based on the region. So that this all things during master session my thesis work on the hepatotoxicity. I do work on the hepatotoxicity, and I have written the review paper also. So in here I can correlate that even though I don't want to do the academics for the very now on, I was not planning to do the PhD, but before I have written those papers, here it is kind of helping me and giving me various much ideas. Okay, how I can predict, and how can I search with those engines, like there is the PubMed, then there is the Google Scholars, and there is. So I would suggest you all, apart from your or studies, please do focus on your review papers, research papers, and do improve your skill set. So, and at last, I'll conclude my statement by saying that thank you, Bhupesh sir, as well as Sandeep sir, so having me here. And it is very delightful for me to back on this platform and to connect with you all. So all the best, all the very best. And you are, and I must say, you all are at a very, very, very nice place. All the best wishes to you all. Thank you.
Now move ahead with the session, and I'm very happy to invite Mr.
Ma'am, just a minute. So, Munazza, thank you very much for joining us today. And I hope students can connect with you later on, right? All MPharm and other biotech students also can join you on LinkedIn if they will, right?
Yeah, sir. Sure,
so,
sir.
Again, in any other case also, we would like to have you here personally,
yes, sir,
or just online. Thank you very much. Have a good day.
Thank you, sir. Thank you for having me. Thanks a lot. Thank you, sir.
So we are delighted to have Paramjeet Manan with us. So just a brief, Paramjeet Manan is an MPharm by his professional degree and a team leader, regulatory information management. He's currently located in Hyderabad. Probably he can give more information on his current roles and responsibilities. He's our first industrial speaker from the industrial sector. Please proceed.
Yes, Paramjeet, you may start. You're muted. You're muted.
Yes, thank you. Hello everyone, good morning. This is Paramjot, and I am currently working in Hyderabad. Previously, I was working in Chandigarh, that is in Paraxel. I have more than 10 years of experience in the pharmacovigilance, and I'm here to explain to you regarding the careers in pharmacovigilance, how you guys are supposed to work with the pharmacovigilance companies, and what are different type of companies which we currently have. So, can I share my screen? I have prepared a very small PPT. Can I do that?
Yes, you can share the PPT.
Okay.
Yes, the right now.
Please let me know once you guys are able to see the screen.
Yes, we can see. You can make it full screen.
Yeah. Now is it okay?
It's absolutely fine. You can
Okay,
go.
great. So basically, the very basic concept behind the pharmacovigilance is that the dying from a disease is usually unavoidable. For example, if someone is affected with the last stage of cancer or the last stage of liver disease or kidney diseases, then it is acceptable that he is going to die. But if we are going to give that particular person a treatment or a drug to cure that particular disease, and he is getting died just because of that cure, then that is not acceptable. Which means if anyone is affected with a very minor disease, and then we give them a drug for the cure of that disease, and he dies not because of the disease but because of drug, that is not at all acceptable. And that is why the pharmacovigilance came in the picture. So pharmacovigilance is the science which is basically related to detection, assessment, understanding, and prevention of the adverse effects and any possible type of drug related problems. So why pharmacovigilance is needed? Because for every coin we have two sides. In the same way, for every drug there are two sides. First is its therapeutic effects, and second one is its side effects. Therapeutic effects are basically the positive effects which we are supposed that drug should act against that disease, and side effects are something which are unpredictable, because any drug which is acting on my body, the way it is acting on my body, it is not at all necessary that it will act in the same way in yours body as well, because we all are going from a different gender, we have a different age, we have a different weights, we have different habits. Someone are non-alcoholic, someone are alcoholic, someone are non-smoking, someone are smoking. So we all have a different rates, we all have a different types of diets. That's why each and every drug should be different, should act different in my body and in yours body. Even if I take a drug, say 1 year before, it is not supposed to act in the same way today which it acted a year before. So that's why pharmacovigilance is very important. So in most of the pharmacovigilance companies, you guys will able to see this type of work. First of all, let me show you how many pharmacovigilance companies are there. So if you go to the Mumbai is basically the pharmacovigilance hub. You are having a large number of companies there: Equia, TCS, Cognizant, Apotex, Cipla, Lupin, Johnson and Johnson's, Abbott. There are many companies in which you guys can apply and can work there. They are one of the most branded companies. Similarly, for Ahmedabad, there are many companies you can see there, like Lambda, Torrent, Zydus, Arcus. These are the most important companies. Delhi, Gurgaon, Noida, you can see there are many companies in which you guys can apply. Similarly, in Pune, and in Bangalore, and in Hyderabad, Chennai. So there are many companies in which you guys can apply. And all these companies basically have a single workflow. And that single workflow is this one, which you can see in a very simple chart. Because of the lack of the time, I have prepared it in a very smaller way. So let me explain you in detail. So this is basically the clinical trials. So pharmacovigilance is developing phase in India. However, in other countries, it is well developed. So clinical trials or clinical cases, you mean to say that each patient is having a single clinical case, right? How the number of patients will be equal to the number of clinical cases you will receive. So all the clinical cases, every hospital will prepare a different clinical case for each patient, and that clinical cases will come to us, which we receive at a case recipient. So there is a different team in every company for the case recipient. And after that, triage is done. Triage is basically a way in which persons usually accept the acceptable cases and non-acceptable cases. After doing the triage, for example, you have received 5 cases, out of which 4 cases are not acceptable at all, and the 1 case is the one which is acceptable, that is further sent. Then there is another team, which is a data entry team. And after that, after performing the data entry, there is a medical review, which means a medical practitioner. It can be MBBS, or it can be MD, or it can be any other stream. They review the whole case. After that, it is a quality control. That is a QC check. And QC check is the most important thing which each and every company take care, because for each step, even in case recipient, even in triage, even in data entry, even in medical review, all the cases are going to the quality control. So basically you can double the jobs. Like if we have 1,000 persons who are doing the case recipient and 500 persons who are doing the triage, then nearly double persons, they are also doing the quality control for each case, right? And once this QC check is done, finalized, after that, the regulatory submissions are done. Regulatory submissions, which means we need to perform the submissions to the EMA, European Medical Agency, or WHO, World Health Organization, and we have to explain them whether that particular drug is suitable for those persons or not. And if it is suitable, then the WHO make it as a safe drug. Otherwise, it can be banned at any time after the post-marketing. So you guys will, it doesn't mean that if I'm talking about a Novartis company, then Novartis company is doing all these steps. Not at all. It totally depends on the client. Sometimes Novartis is doing only case recipient, and triage is done by some other company like Johnson and Johnson's, and data entry is done by some other company. So it is totally interlinked work. So there is always a bidding between the companies. Whenever a client, say Johnson and Johnson, came by taking some work that they have a drug and they have a multiple cases and they want all these procedures, so they will come to the different companies and the companies will bid for that work, and the bidding which is the most acceptable to that client, that particular work will be given to that client, and then the persons will be hired and they do the same work. So these are the multiple companies in which you guys can apply. How to apply? See, if you are thinking that you guys will send a hard copy or you will send an email to the HR, they are the very you can say the very old methods in which you can apply, but usually today's in current scenarios, no company is accepting your hard copies of your CV, and no companies will take care of your email, which you will send it like, this is my CV and please consider me for this particular role or something like that. No HR will consider those emails, because each and every HR of these companies, they get thousands of CVs in a day or thousands of emails in a day. So they just completely ignore your emails. So how you guys are supposed to apply? You guys have to go to that particular company's official website, and each company's official website have a portal that is a recruitment, and in that recruitment you guys have to make your ID. Like you guys make your ID in Facebook or in Instagram or in any other social media. You guys are supposed to make your IDs there as well. They will ask you about your name, your first name, your last name, your official email ID, as well as your mobile number. Then you will receive an OTP, and once you put the OTP in this web portals, then an ID will be generated under your name. And in that ID, you will be able to see currently how many jobs are present in that, how many recruitments are going on in that particular company. And from there, you have to select in which recruitment or in which you can say job profile your job profile is matching. And after that, you can select on that job profile and then add your CV. And then that HR will come back to you, and then he or she will take an interview for you. So these companies get work from different clients like Sanofi, Johnson & Johnson, Lupin. There are many companies. You can say nearly 1,000+ companies are there from all over the world. And India is basically a hub for them. Why? Because if I consider about say Sanofi or say Johnson & Johnson, any company, the workers who are currently studying, who are currently working in their say Canada or in other different countries, they are very costly for them. So India is a hub for them, because India not only work with the accuracy, and also it give a cheap work. We do not cost for those companies so much high. So that's why they always come to India, and they give us so much of amount of work. There are many different type of reports. I wanted to go to detail, but I think there are very less time. So just want to thank you. And if you guys have any doubt or any information you guys need regarding the companies and how to apply, please come back to me. I will be there to help you. Thank you.
Any question? Thank you, Param. Any questions from the audience to Param? Please raise your hand. He's from the industry. He's our industry guest. but echo हो जाएगा.
So I hope you can hear me.
Yes, I can hear you, but there is a echo.
ठीक है.
So thank you, Paramjo, for this session and taking out time.
Thank you, sir.
Industry perspective was also being sought for the new batches. We have asked what queries students have or the new batch of students have. So just in case if they have some queries, so we'll just go through the thing. So I think they have taken up the session in the the flowchart that you have shown. I think that gives a very summarized content as to the details of the companies as well as the process. I hope that they will be making use of it and carrying it forward. We would like to have much more expanded session in the future with appropriate planning whenever you are free, and at physical also, if you are in Delhi, we would like to have you here. And thanks once again for taking out whatever time that you could do. I hope it did not disturb your routine.
No, sir, no. Thank you so much for inviting me, and I will really love to, guide them further in future.
Thanks, Paramjo. We will meet again.
Thank you so much. Thank you, everyone.